words are all I have to take your heart away.
The eyes are our windows on the world. More sensory data enters the brain from our eyes than from any other sensory modality. In this video, we will tour the language of the eye and its disorders. Eye is a term from merry old England. Oculus is the Latin word for eye. The occult is that which is hidden from the eye. Surrounding the eye is a muscle called the orbicularis oculis, the circular muscle around the eye. It's the wink-wink muscle that forces the eyelids closed. If you get a refraction, your eye doctor will give you a script with OD and OS on the script. OD does not label you a drug user. Instead, it stands for oculus dexter. Dexter is a Latin word for right. This is a prescription for your right eye. OS stands for oculus sinister. Sinister is Latin for the left eye. Left-handed people are sinister too, you know. The Greek term for the eye is ophthalmos, from which we get the name of the medical doctor who diagnoses and treats eye diseases, the ophthalmologist. Ophthalmologists can prescribe any drug and do surgery on your eyes. Optometrists are more limited in what they can do. Mostly they screen patients for eye diseases and measure their vision for corrective lenses. Opticians mostly work with patients to fit their corrective lenses. The wall of the eye is composed of 3 layers, or tunics. The outer tunic is called the fibrous tunic and includes the white of the eye, known as the sclera. Sclera is from a Greek word that means hard. Malacia means soft. What do you suppose scleromalacia means? It's a soft spot on your sclera. Sclerotomy is an incision into the white of the eye. Scleroderma, meanwhile, has nothing to do with the eye. It means hardened skin. Most of the fibrous tunic is opaque, but the front is transparent. This transparent portion is known as the cornea, the window to the eye. The middle layer of the eye is called the vascular tunic because it's rich in blood vessels. It's also called the uvea. The anterior uvea is composed of the iris and the ciliary body. The posterior uvea is a dark layer called the choroid. Inflammation of the iris and the ciliary body is called anterior uveitis. Inflammation of the choroid is called posterior uveitis. The innermost layer of the eye is the neural tunic, more commonly called the retina. The retina contains the photoreceptor cells that respond to light and generate electrochemical signals that pass into the brain. The retina lines the choroid, but not the front of the eye. The eyelids help protect the eye and keep it moist. The Latin term for eyelid is palpebra. From the Latin name, we get the name for the muscle that raises the upper eyelid, the levator palpebra superioris. Levator means to raise up. Palpebra superioris means the upper eyelid. If you can't contract your levator palpebra superioris muscle, you will have a droopy eyelid, known as blepharotosis, after the Greek word for eyelid. If you have sagging upper eyelids from excess skin and fat, you may need cosmetic surgery, known as blepharoplasty, to relieve the obstruction. Pigs have styes, and so can eyes, but the pigsty is spelled S-T-Y, whereas the sty of the eye is spelled S-T-Y-E. Tell that to your textbook author. A sty on the eye is an infected sebaceous gland in the eyelid. The conjunctiva is a transparent membrane that lines the visible surface of the eye and the internal surface of the eyelids. The part that's on the eyeball is called the bulbar conjunctiva. The part that's on the eyelid is called the palpebral conjunctiva. Did you ever wake up in the morning to find sand in your eyes? You wash the bedclothes and vacuum the floor, but the next morning the sand is there again. So you install an air purifier and change the lock on the door to keep the Sandman out, but it doesn't help. What's going on here? The problem is that the Sandman is you. The conjunctiva is a mucous membrane. When we're awake, the mucus is kept moist by our constant eye movements. But at night, the mucus near where the eyelids meet dries out and becomes sand. And if this sand scratches the conjunctiva, it can hurt like the dickens and cause conjunctivitis. Conjunctivitis can be caused by allergens, sand in your contacts, or more seriously, microbial infection. Infectious conjunctivitis can be passed to your friends and family. The popular term for conjunctivitis is pink eye, reflecting the increased blood flow to the surface of the eye and the hemorrhaging of blood vessels.
Oh, it's crying time again. You're gonna leave me. I can see that faraway look in your eyes. I can tell by the way you hold me, darling, oh, that it won't be long before it's crying time.
If you're crying, I hope they're tears of joy. Tears are produced by exocrine glands in the superior lateral orbit of the eye. These are called lacrimal glands, after the Latin word for tears. The tears drain via ducts onto the surface of the eye, where they keep the eye moist. They can also wash debris from the surface of the eye. Our tears may help relieve emotional stress. So if you're feeling stressed out, go ahead, have a good cry. When you cry, you may find tears running out your nose. That is because the tears drain into the nasal cavity via the nasolacrimal canals. Xerophthalmia means dry eyes. The Xerox company invented a dry copying process, replacing the old mimeograph machine. They took their name from a Greek word that means dry. Xerophthalmia can be caused by lack of tears. If your doctor diagnoses your dry eyes from lack of tears, she may place punctal plugs in your nasolacrimal canals to keep your tears on the surface of your eyes. These plugs may be temporary or permanent. There are also topical and oral medicines you can use to treat your dry eyes. A more serious cause of dry eyes is vitamin A deficiency. Vitamin A is essential for both the front and the back of the eyes. Vitamin A deficient xerophthalmia can lead to permanent blindness and is a leading cause of blindness in poor countries. The Greek term for tears is dakrion. If you want to talk Greek, an inflammation of the lacrimal glands can be called dacryoadenitis. Recall that adenos is Greek for glands. If your nasolacrimal ducts are blocked, you may need a dacriocystorhinostomy, which is an artificial opening into the nasal cavity to drain your tears. The transparent portion of the fibrous tunic that allows light into the eye is called the cornea, the window to the eye. The job of the cornea is to refract light, meaning to bend light so that it's focused precisely on the retina. If our cornea is doing a satisfactory job, we say our vision is emmetropic. If the cornea is misshaped, our vision will be less than desirable. This is called ametropia. If the cornea bulges out too far, making the eyeball too long, the condition is called myopia, meaning squint eyes, because to see clearly at a distance, you need to squint. Another name for myopia is nearsightedness, meaning we can see near but not far. If our cornea is too flat, making the eyeball too short, we have hyperopia, also called farsightedness, for we can see far but have difficulty seeing near. Some people have corneas like the streets of Kansas City after a brutal winter. Asymmetrical corneas with potholes. The result is distorted vision called astigmatism. All these ametropias can be corrected using prescription lenses or surgery on the cornea. If you have some extra cash and nerves of steel, you may submit to surgical correction of your ametropia. Since the 1990s, lasers have become the dominant tool for the surgical correction of vision. Illustrated here is a laser procedure called photorefractive keratectomy, or PRK, which was first approved in 1995. Keras is the Greek name for the cornea. The laser reshapes the surface of the cornea and can correct for myopia, hyperopia, or astigmatism. Following the procedure, a transparent bandage is placed on the cornea while it heals. In 1998, the FDA approved another laser technique for correcting ametropias, LASIK, which stands for Laser-Assisted In Situ Keratomileusis. The procedure differs from PRK in that a flap is peeled away from the front of the cornea before the laser reshapes it. The flap is then put back in place. PRK and LASIKs are done as an outpatient procedure using topical anesthesia, meaning you get to watch the surgery. If you rub your eyes, you may notice your vision is blurry for a while, but soon returns to normal. Rubbing your eyes distorts the cornea, but the liquid in back of the cornea, called the aqueous humor, forces it back to its usual shape. Aqueous humor is filtered blood that is continuously being produced and removed from the anterior eye. Just as you can have too much money and too many lovers, you can produce too much aqueous humor. The result is glaucoma. Glaucoma is elevated intraocular pressure that can damage the retina and the optic nerve in back of the eye. Your eye exam should include a glaucoma screening. This can be done by placing a numbing drop on your eye and then pushing on the cornea using a tonometer to measure how much the cornea pushes back. If your pressures are above 21 millimeters of mercury, you may be asked back for a repeat screening. If they remain elevated, you may be prescribed daily eye drops to lower the intraocular pressure. The aqueous humor surrounds a pair of muscles in the eye called the iris. We use the iris to describe a person's eye color. The more important job of the iris is to regulate how much light can enter the eye. The iris has a hole in the center called the pupil. The contraction or relaxation of the iris muscles can change the diameter of the pupil and the amount of light entering the eye. On a sunny day, the pupil is constricted to reduce light intensity. In a dark parking lot, the pupil is fully dilated. Your eye doctor will want to look deep into your eyes during your eye exam. But when she shines her light in your eyes, your iris shuts down your pupil. No amount of persuasion can prevent this reaction, so your doctor will place mydriatic drugs in your eye to block your pupillary light reflex and keep your pupils dilated. One such drug is atropine. A drug that has the opposite effect of a mydriatic agent is a miotic agent. Miotic agents like pilocarpine make your pupils smaller. Behind your iris is a ball of protein called the lens. The Greek word for the lens is phakos. The lens differs from the cornea in that its curvature can change, so we can focus near or far. The lens is attached to a muscle called the ciliary body or ciliary muscle, whose contraction can move the lens forward in the eye, allowing the lens to recoil and thicken. This is called the accommodation reflex. You're viewing an animation of the accommodation reflex. When you look at an object closer than 20 feet, your ciliary muscle contracts, pulling the lens forward in the eye where the eye is narrow and the lens recoils, becoming thicker. When you look at objects 20 feet or beyond, your ciliary muscle relaxes. The lens recedes back in the eye where the eye is wider and the lens is stretched thin. This reflex allows us to see clearly whether we're looking at our odometer or down the highway at an oncoming car. Distance vision is less stressful to the eye than near vision because distant vision does not require contraction of the ciliary muscle. Don't take a break from studying to knit. Instead, go outside and look at the birds. When you go to your eye doctor for a refraction, you're given two tests. One is set at 20 feet to test your distance vision. The other has you reading the fine print on a card to test your near vision. As we age, our vision deteriorates. This age-related changes in our vision are called presbyopia, literally meaning old eyes. For example, you may have never worn reading glasses until you reach age 50. Then you notice you must hold your reading material farther and farther away until your inability to read exceeds your grasp. At that point, you swallow your pride and buy reading glasses. We say your near point, which is the nearest distance at which you can read, recedes, and this is due to a deterioration of the lens. The lens contains no living cells and cannot regenerate itself. As we age, the lens loses its elasticity, or ability to recoil. If your near point recedes beyond your grasp, and you already wear corrective lenses to see far, you will have to purchase bifocal lens, where the upper lens corrects for distance vision and the lower lens corrects for near vision. Cataract is a loss of lens transparency. The word cataract means waterfall. So viewing through a cataract lens is like viewing through a foggy window. This man has a cataract in his right eye, and it is reflecting instead of transmitting light. Before the 20th century, most people went blind because of cataracts. Modern cataract surgery was born in the 20th century, but until the 1970s, it was major surgery, requiring hospitalization and extended recovery time. In the 1980s, that all changed with small incision cataract surgery. The current procedure introduces a cutting device called a phacoemulsifier into the lens capsule through a tiny incision. This device chops the lens into tiny particles that can be sucked out of the eye. Then a flexible implant is injected into the lens capsule through the tiny incision, and the implant is opened inside the eye to replace the diseased lens. Usually the surgery is done under local anesthesia, and the patient can go home within an hour after the surgery. Behind the lens is a large chamber filled with a jelly-like fluid called the vitreous humor. The purpose of the vitreous is to support the retina. The vitreous is normally transparent, but as we age, proteins in the vitreous may cross-link and cast stringy shadows on our vision. In addition, blood cells may enter the vitreous, where they are trapped and cast spherical shadows on our vision. These particles may be mobile and so are called floaters. When they first appear in the eye, one may swat at them as if they were gnats. Eventually, though, you accept that they are inside, not outside the eye. You ask your eye doctor for help, and most likely you'll be told to learn to live with them. However, there is a procedure available since the 1970s that can remove them. But it is a risky procedure, so it's only performed when the opacities are a major impediment to vision. The procedure is called a vitrectomy, surgical removal of the vitreous. Usually, 3 openings are made through the sclera. One is for a light source. The other 2 are to simultaneously remove and replace the vitreous. If this isn't done simultaneously, the retina could collapse off the wall of the eye. The retina is where the photoreceptor cells are located that respond to light and signal the brain. There are 2 families of photoreceptor cells, the rods and the cones. The rods are active in the dark and allow us to see shades of gray. A deficiency in the rods leads to night blindness, also known as nyctalopia. The cone family includes 3 unique receptors known as blue cones, green cones, and red cones. When you view them under the microscope, they don't look blue, green, or red. Instead, the colorful names reflect the wavelengths of light they respond to. White light is composed of different wavelengths that can be separated by a prism into the colors of a rainbow: red, orange, yellow, green, blue, indigo, violet. We can see these colors thanks to the 3 families of cones that respond best to different wavelengths. If you're missing one or more of these family of cones, you won't see the range of colors others can see. The deficiency is called achromatopsia, or color blindness. The most common form of color vision deficiency is called red-green color deficiency, or daltonism. Red-green achromatopsia is more common in males than females and results in their inability to differentiate between red and green. That means they cannot tell whether a stoplight is red or green unless by custom you put the red light on top and the green on the bottom. The Ishihara test is used to evaluate a person for achromatopsia. Here is a plate from the Ishihara test. What symbol do you see? If you see a 74, you do not have red-green achromatopsia. Your eye doctor will want to view your retina during your eye exam. After administering the mydriatic drug, your doctor will use an ophthalmoscope to gaze into your eye. This is what she will see. One area of the retina that will receive special scrutiny is called the macula lutea, which is Latin for yellow spot. The macula is where the cones are concentrated. It's responsible for our color vision as well as our reading vision. If the cones of the macula die off, we develop macular degeneration. On the left, you see what a healthy person sees. On the right, you see what a person with macular degeneration might see. As macular degeneration progresses, a person requires larger print to read and eventually can no longer read at all. There is no cure for macular degeneration, and the end result is blindness. Retinitis pigmentosa is a group of rare genetic disorders that involve a breakdown and loss of cells in the retina. Symptoms begin early in life and include difficulty seeing at night and a loss of peripheral vision. Later, the disease affects the central vision, causing difficulty reading and eventually total blindness. The retina is held to the inside of the eye by the vitreous body. A blow to the eye can detach the retina, or it may detach spontaneously. Regardless, you will most likely experience a burst of floaters in the eye, and a curtain slowly descends into your visual field. It is critical you get to an ophthalmologist as soon as possible to preserve your vision. A technique called pneumatic retinopexy is used to fix the detached retina back to the wall of the eye. First, the vitreous is removed and replaced with a gas bubble. The gas bubble forces the retina to the wall of the eye, and a laser is used to seal it to the wall. The gas bubble gradually is resorbed from the eye over several weeks and replaced by a watery fluid. Our two eyes give us binocular vision. Because the visual fields overlap, we have stereo vision. This permits depth perception. Some people's eyes do not align, and the condition is called strabismus. Surgery may be necessary on the muscles that position the eye to correct the problem. Some people cannot control movement of their eyes. One or both eyes may dart around involuntarily. This is known as nystagmus. The condition may be congenital, or it may emerge later in life. Often the condition will abate on its own without treatment. Amblyopia means lazy eye. This is a condition where the brain prefers one eye over the other to the extent that the unused eye may eventually be unusable. The problem is not in the eye, but in the brain. The common treatment is to patch the dominant eye intermittently to force the brain to use the other eye. Amblyopia reveals that we don't see only with our eyes. Our brain is essential for vision as well. The signals from the eye usually reach the part of the brain called the visual cortex of the occipital lobes. Here the signals are interpreted as vision. If your visual cortex was damaged in an accident, you could be blinded even though your eyes are perfectly healthy.